All right, we got about 1 minute left and we'll get going. Let's see here. Okay, you got what you need? Feeling comfortable?
I gotta get my food.
Yeah, definitely cook some food and eat while we're going.
Well, I mean, I'm just waiting for it to be done.
Oh, okay.
See real quick if it's done, and then, yeah.
Okay, we're just waiting to get started here. A couple people cooking their food and bringing it. We're doing a lunch program here at Maybell Center for community, taking care of their community through, and we're serving the nurses here today. Hey, how's it going? So, what's your name?
Gary.
Gary?
Yeah.
Nice to meet you.
Nice
I'm John.
John.
Yeah.
Nice to meet you.
Yeah, nice to meet you. So we just got about just 1 minute. We'll get going.
Oh,
Do you have your food and anything that you need?
I ordered my food, so
Cool.
said 1 minute.
Yeah, about 1 minute. We'll get going. Don't worry. Like you'll be able to jump in anywhere once we get moving.
Okay.
Yeah.
In the meantime, I will grab my notes.
Yeah. Do it. Yeah. Well, I'll be here.
You are, but I will take out my notes. I have my notes.
Okay. Sorry.
You can move around.
Yeah, I think they'll bring it to me.
Really? That's nice.
Yeah, I'll let them know it's here. 'Cause, we have to open the community room at 1, so.
Okay. Let me get going because if we hold up too long, if we get into Q&A, because I try to be interactive while we're doing it. So please jump in if you're like, hey, just raise your hand or just speak up.
Okay.
I'd rather speak like that. It's a little bit more fun than just pontificating the whole way
Yes.
through. So, but I'm gonna get going. I let Gary know where we're at. And then, so today we're talking about ergonomics. And really the big thing with ergonomics is not what you think. Everybody thinks that we have to have our screens in the right place, our mechanics straight, but that's kind of the cart in front of the horse scenario. So today I want to talk about those important parts of the mechanics of ergonomics, but also extend that conversation into why and how it can spin off and help us reduce stress and increase happiness and productivity, focus, energy, reduce fatigue, because that it's not just about carpal tunnel and low back pain. So let me jump into that. So the average worker tends to sit. I know y'all are nurses, and it's a different type of ergonomics, but sitting is kind of like, what's that?
I'm not a nurse.
You're not? Oh, okay, but so no matter what, what's going on? So today we're talking about ergonomics, and we're talking about the depths of ergonomics. So whether it's just sitting, standing, lifting, all these sorts of things is going to have a play in how our brain works and how our body works and how we can reduce pain and increase focus and happiness. Sitting, whether we're sitting and watching TV or at home or in the car, it's a thing. And how we can do it and understanding why, I'm a why guy, it helps a lot of people get better and stay better. There are four S's in the world, the dangerous S's. We all know smoking. Everybody, that's an easy one to point a finger at. Is smoking's no good. The other one that we're getting to know more and more is sugar. Sugar is causing so much metabolic disease. It does affect our mind. It affects our body. But the other two is what we're talking about today: sitting and standing, and how we're doing that, and what the repercussions are, and how that can actually get a positive feedback loop, and getting rid of the previous two. Getting rid of the smoking and getting rid of the sugar actually can start with how our posture is. The nice thing is no matter how much you sit and how much you stand, there's ways around making it work for you, and that's what we're going to dive into today. Ergonomics is a science, but in the science, it's usually what's lost in it are the secrets, and that's one of the things I do as an acupuncturist is I'm working on the subtleties that actually give the biggest paybacks. And in this one, it's going to come through your breath. Because we're looking at ergonomics as a structure, and then a lot of times we talk about the catch terms are like carpal tunnel, low back pain, and how we're doing that. But at the end of the day, if we don't acknowledge the fact that how we're breathing is such an important component of that, we're going to lose so much value and not have an understanding of what we're doing. And when we don't understand that, I mean, like as a parent, I I've been a school teacher, I'm on faculty at the medical school. I like whys, my students like whys, my kid likes to understand, well, why, Dad? So let's go into that a little bit. So anything that you do in life has an ergonomic perspective, and some things haven't been updated. Apparently keyboards are a function of how a typewriter works rather than actually how we work. But as we go through life, everything that we do is ergonomic. The shape of these chairs, the height of these tables. It's interesting how much we walk through life and see where it is, and making sure that we understand different parts of our body and how we feel better. So when we're looking at ergonomics, we're looking at different parts of our body. We're definitely looking at our neck, because our neck is holding like a 7 to 10 pound ball. And so how we hold that's really important. Whether we're walking around with our phone and holding that up, sitting at our desk, but also how our arms are and how our hands feel. And then also like our low back is a really big one. How our legs feel, we can get sciatica, we get carpal tunnel, things like that. But the one that I'm gonna say it again and again, is the one that we always forget is a diaphragm, is how we're breathing. Because when we do that, we're collapsing our diaphragm. And then from here, everything else can get better. So these are the secrets of what ergonomics is all about. So proper ergonomics, when you think about it this way, that when you expand your view of ergonomics, you realize that you're not just getting better for musculoskeletal issues, but you're improving your anxiety, fatigue, improving focus. And then people have more energy, they're happier at work, they're happier at home, and those are the gifts that keep giving. I mean, don't get me wrong, there's plenty of people I work with on a daily basis that have carpal tunnel syndrome, and that's a thing. And whether we're starting from that end, that it's impacted because we're collapsing and causing carpal tunnel, or we're catching it early, and hopefully we have this opportunity to talk about it now. These little things will change our eye strain. It will change how we get headaches. This is a holistic perspective, and as an acupuncturist, I'm always looking at the whole system. And so this is what we're going to be diving in deeper and deeper. And again, just managing the depth of what the impact of ergonomics is. And I'll say it's really the fatigue and the focus. But what you get out of that is just a reduced productivity, irritability, you don't get along with your people, increased errors. I mean, we get edgy if we're breathing these short little breaths. And at the end of the day, honestly, people are just not satisfied with the people that they're surrounded by. And we should be happy at work. I mean, like, y'all are in service. And I'm like, tip of the hat to you, just bow to you, because I know that you're taking care of people that need a lot of help. So making sure that you have a little extra tool in your day-to-day, because I mean, that give back that you do professionally should give you satisfaction. And so let's make sure that there's just a little bit of extra possibilities out there for you. So what do we do? So let's take a look at some of the tools that we can have. Some of these things you've heard before, and hopefully a couple of these things you haven't, and they'll make all the difference and get you some traction on the typical things of stand up, get nice structure. If you're lifting, if you're sitting, or if you're exercising, same thing applies. If you're an athlete, I mean, and we're all athletes whether we know it or not. I mean, we're all working really hard. I don't know many people that aren't. So our spine is really important, obviously. This is one of the main conduits of information in our body, but it also, in doing so, there's so many branches, and we want to make sure it has proper curves. And we eliminate those when we're doing things funny, and that also includes our sleep, and we'll dive into that too. But out of the central nervous system, we have all the nerve branches. So I say to my students at the acupuncture school, one of my favorite nerve, I always drill them, what's my favorite nerve, everybody? And it's the vagus nerve. Of course, the central nervous system, the spinal cord is really important, but the vagus nerve, it's a 10th cranial nerve, and it comes out right in front of your ears here, and it comes down and it innervates all your visceral organs, your diaphragm included. And nerves are a two-way street. They're sending information out from the central distribution center and then taking information back. And when we do that, we want to make sure that it's getting good information, because if we're collapsing that nerve conduit, that nerve circulation, whether it's for a carpal tunnel scenario, collapsing down, there's atrophy and there's bad feedback that comes through. So each vertebrae has an outlet, a nervous system outlet, and it's going to branch out. These are dermatomes. Some of y'all are nurses, you know what I'm talking about. You just follow the dermatome, how it passes, like how it travels down, whether it's sciatica, you know which dermatome, which vertebrae that branch is coming out from. So we want to make sure that we're maintaining that structure. Love this guy. He's just overemphasizing it, but I mean, it probably isn't that far different. You just walk around. I mean, like I walk around my kids' junior high, and like everybody's just walking around like this. We all do this, so making sure that we just take a moment and check in, because it's really at the end of the day is going to be, the rubber's going to hit the road when you just take a moment and check in with yourself, and that is one of the gifts that keep on giving, is paying attention to yourself and checking in and knowing where you're at in the world. And then you can interact with it, and whether it's good or bad, you have better boundaries to receive and give and halt when things are not the way that are appropriate. So our posture controls our breath. It is the beginning and the end of everything that we're talking about. If we're not maintaining good oxygenation, we're going to have poor cardiovascular circulation and poor nerve circulation. And when that happens, our opportunities for pain increase. We actually become more acidic. Probably everybody's heard of like apple cider vinegar and things like that to reduce your acidity. Well, honestly, the best way to reduce your acidity is to breathe. Because if we're not breathing and exhaling well, we're holding more carbon dioxide in our system. And even with slight elevations in carbon dioxide, we have increased carbonic acid in our veins. And that causes inflammation. It causes so many different problems in our health. It slows our metabolism. It addles our brain. We get irritable. And then at the end of the day, we want to make sure that we are pain-free.
And then that way too, it would be natural for us to operate on an alkaline type of,
Yes.
in a way,
Yeah.
in a sense.
That's exactly, yeah. You hit the nail on the head there. Because we want to increase that alkalinity, and when we are more alkaline, like you said, everything works better.
Yeah.
Everything. And then, I mean, like, because it's basic, when we're taking apple cider vinegar, you're working on acid-base chemistry, but one of the tricks is, the problems with that is, most people are actually hypochlorhydric. We have low stomach acid. Most people that are taking PPIs, like Ozempic, is it Ozempic? No. The proton pump inhibitors that everybody takes for heartburn, it's lowering our stomach acidity. And so they're actually lowering stomach acidity where it's already too low. But that's a whole nother branch, but to just emphasize the importance of being alkaline. And so, this is a little known fact, and I love this one. I learned this one from a guy named Jim Quick, and he does a lot of cognitive performance trainings. You can find them all over the internet, all over social media. I really like him. Really enthusiastic guy that was making sure people read better, think better, and remember better. But one of the most important things I heard him say was 2/3 of our oxygen absorption happens in the bottom third of our lungs. So if you just feel where our ribs are, and you know, as you lean down, like this lady in the picture is leaning down, that's not how you're gonna solve a problem, my friends, is closing off the oxygen. So, because those ribs just go in and collapse that lower 2/3 of your lungs. So again, the why, we wanna keep, that's the core. This is the pivot point of our posture. This is the pivot point of our ergonomics, and that's gonna make a huge difference. And so, like, I'm trying to breathe deeply here because I'm going, but that is helping me stay ahead of it. Now, one of my favorite, it's kind of a bad word, but I love it, and let's lean into man-spreading, okay? So y'all know what this is, right? You sat next to somebody and they're like, yeah. Man-spreading is something I want to encourage everybody to do. Be kind to your neighbor, but I want to encourage that. And I love this photo because she's just really engendering what I'm talking about, is making sure that you're stretching out. I hope I don't step on my wife's toes, but she has a poster of Wonder Woman at her office. So when she walks out of her office, and if you ever see, you know, the old Wonder Woman from like the 80s, the 70s and 80s, she always stands like this, that man spread. It's like but we can call it a people spread. Yes, I don't know, but it changes our nervous system, and there's a lot of research that shows how beneficial it is. I was quick story. I had an opportunity to travel through Vietnam. Like 27 years ago. It was like 1998, maybe messing up the math, but I was on a night bus, and it's a tiny little bus, and it's a 12-hour bus trip. It starts at dark. You wake up at dawn. I sat next to this gentleman. He wasn't very gentle, and he just man spread really hard. And I was cramped, I had nothing, and I was starting to get angry, and I was irritated, and I knew I was gonna have a really long 12 hours in a tiny little cramped van, knowing that he's leaning into me. This really just, hopefully you'll never have to do it, and I don't recommend this, but I was trying to make sure, I was like, okay, I don't wanna create a conflict here, but, so the underbelly of man spreading is what I did is, I just reached and put my hand right here on his inner leg, and that guy shut down and closed up, and I had all the space I wanted for the rest of that 12 hours. Now, I don't know if that's really going to help you other than just maybe make you feel funny about it, but at the end of the day, I want to encourage that stretching out, and you don't have to go to a yoga or Pilates class for it. I want you to just stretch, just like before you go out into a meeting, put your hands on your hips, enjoy, spread out, and we'll do a couple exercises as we go down through this talk. Again, like this is the pivot point is keeping that curvature in your spine, because our spine will train out of a curve. You've seen some of our elders, and they're starting to get that hunch that they're carrying the weight of the world.
Like scoliosis.
Yes, and that's a little bit different. Some people are born with that, but it gets emphasized with people walking around like this. Just carry yourself a little bit differently. Play with it, and you'll know it because your breathing will be easier when you align. When you get it right, you'll get that nice diaphragmatic expansion. Now let's go into some of the mundane things, some of the simple things that I would just do a quick reminder. Chairs, super important, but you don't have to go out and buy a massively expensive chair. But I'm sure I know that there are $1,000 chairs out there. You don't have to go crazy for a proper chair. You can trick it out with cheap pillows and make sure that, and there's you've probably seen these pillows you just strap on, and then make sure that you're not leaning too far back. Your car is also another place. I want to make sure that everybody understands we're sitting there and you're accommodating your posture, so you're keeping that lower back supported when you're in the middle of a thought or doing your thing. And then the position of our legs, because we don't want to be overextended and we don't want to be cramped up. We always want to have our knees just slightly bent so that our lower back can relax. And when we're sitting at our desk, we want to have our knees, our tops of our legs at a 90-degree angle. If you can't do that for any particular reason, things as simple as a phone book can be helpful. Just go right ahead and tuck something underneath there. Again, all over Amazon, you can find these little micro-adjusting ergonomic foot stands, and they'll angle and they'll accommodate you so that you can feel like that. And again, going back to the breath, so you'll know when you're in that right position, when you feel comfortable breathing. Driving, super important. Some people are professional drivers. Actually, a lot of truck drivers, and that's a big deal. And it just emphasizes how critical our sitting posture is. So just make sure that you're not sitting all the way back and just leaning too far. You want to have your knees forward just a little bit, your arms bent slightly. And these will be really important things to apply to all circumstances. One of the other things that I didn't make a slide for, but is sleeping. Sleeping is hopefully we have a lot of nice long nights of sleep. That's a whole nother conversation. But when you are asleep, is maintaining a good posture. And one of the things that I work with a lot of people is they'll curl up and they'll catch themselves at night curled up. So make sure that if you have a pillow or a stuffed animal or something, maintain an open arc so we want to maintain an open arc that just really engenders circulation of our nervous system and our blood circulation. Because if we don't, that carpal tunnel is really more like a kink in the garden hose. If you can't get the water to the garden because there's a kink in the hose, then the garden starts withering and dying. And that's really, my uncle's an orthopedic surgeon and he's a hand specialist. And so I've had these conversations with him. And because, I mean, I guess if your only tool is if you see the world as, if your only tool is a hammer, you see the world as a nail. His only view is carpal tunnel syndrome, neuropathy in the hands, cut the carpal tunnel. And holidays could get a little out of hand at our house because sometimes if we break off and have a conversation, I would be arguing like, no, it's not here, it's here. But that doesn't make him money. So, but at the end of the day, just keep in mind, one of the sweet spots is gonna be sitting at the computer, but don't forget sleeping and make sure you're on a good posture. But I'm not encouraging people to buy a crazy extravagant bed. But these are really important. Now here's a funny little statistic that really took me back. I don't know how much typing y'all do, but welcome. But if a person is typing 60 words per minute for 6 hours a day, I mean, I type a lot, but I'm not constantly typing. That's the equivalent of pressing your fingers for 27 tons per day. Those little keystrokes add up is what that counts to. So 60 keystrokes, well, that's 60 words per minute for 6 hours a day. So I mean, like the average word say is like 5 keystrokes. Those little tiny, what I'm trying to impress upon you is that a little bit goes a long way and it adds up. And something else I want to add to maybe something that will be helpful if you like hiking, you're walking a lot, get some walking poles. It changed my life. Those little walking poles might not be like, might not make the cover of a fashion magazine, or win the cool award, but it takes 5 pounds off of every step. And again, just like this statistic, a little goes a long way. My knees were so much happier when I started hiking with poles. And just keep in mind, these keyboards now are they take less push, but that's a ton, no pun intended, that's a lot of effort that our hands do. And so this just going through what it really means. And and this is how our sports are. I work with a lot of people that do knitting and sewing. Like these little things that we do, bring what we're talking about into that, and just so you can make sure you're always enjoying life, and it will increase performance. So if you or somebody that you know is an athlete, like maintaining that entire structure, whether it's a pitcher or a football player or something like that, or a soccer player, these bringing it all together, and you always hear an athletic coaches make sure you're breathing, because it all starts there. And again, we're just talking about carpal tunnel syndrome. I think we've gotten through that quite a bit. There's a couple simple exercises that are typical, and there's a lot of hand stretching. And you don't have to do this every 2 hours, but especially if you're breathing well and just keeping stacked, you're gonna get that circulation. But let's make sure that you have some tools. Simple said, just keep that phone out of your ear. Don't be doing this. Get your earbuds, whatever. That's just one of the worst things that I would love to see everybody change. And it's gonna catch you up on headaches and the neck pain, focus, anxiety, stress. It all goes away with oxygen. And then following some rules at home, get a headset and it will reduce stress. One of my personal favorites and obstacles is reading, and it goes for our phone. Again, it's a tricky one. I love reading, and so I've kind of my house is starting to get littered with little ergonomic stands so I'm not going like this and collapsing down and shutting down everything, but keep everything up at a 25 to 30 degree angle. Again, Amazon, you could probably get this for $12 or less. You can get a little bit more exciting ones. I have one that's on a stand that I can sit on a couch and put it between my legs, and I can put a computer on it, or I can put a book on it, and it angles, and I think it's like $40. But these are some things that will really make a huge difference if you love reading. And careful for that bedtime reading, because it's probably one area that I haven't really conquered. And if you find you're falling asleep while you're reading, a lot of people complain of that. 2 things. Again, oxygen. Are you shut down? Are you a lot of people are like, oh, I just read the same thing over and over and over. Does that sound familiar? I read it again and I don't remember what I read. Just give your brain some oxygen and I bet you're gonna get retention up. So keep those angles up. Computers, I think, are you guys having an ergonomic assessment? Do you have a team coming through here that's setting up your computers? Yeah.
I heard discussion about that, I don't know if anything's been finalized.
Okay.
That's my understanding.
I'll just breeze through this a little bit. Just, and again, there's really most of it's logic, and I'm trying to give you tools so you can quick assess where you're at any time. And it's good to have a service to kind of like help you, whether you're riding a bike, getting your bike fit for you for cyclists, but to get your desk fit for you is also really important. Make sure that you have, going back through it, you got that back support in here, and that your feet are elevated. And just know that if you're not breathing well, you're doing it wrong. If you feel like you're a little extra stressed out, test the other way. And I bet you're welcome to email me and drop me a line and say, yeah, I feel less stressed today, because I bet you will. It's a thing. And then for those of us that sit at desks for longer periods of time, there's really good research out there that shows some of the most successful people in the world only work at less, I think the number is like 52 minutes stretches. They get up every 52 minutes. They get up, they move around, they do something, and then they go back to work. There is the discipline thing of like, don't get distracted and stick to your guns and keep going back to your spot. But get up, move around. And that's important if you're on an airplane, because circulation drops. If people come into my clinic and they tell me about unusual leg cramping, you guys probably know this if you're taking care of people. You might have a thrombosis. And if somebody said, oh yeah, I was just on a flight going across the country and I got up and my legs started cramping, it might just be a dehydration and electrolytes, but it might be the circulation didn't work and they had a deep vein thrombosis and they got a clot in their leg, and you got to test for that. I've actually had a couple of them walk into my clinic, and luckily I was like, no, you don't pass go. You get an ultrasound now. Hit it head on out. And it was true. That's what happened. But the other one is electrolytes. So, but the short version is get up and move around. Eye strain, headache, the culprit of headaches. I want to give you an exercise today. Hopefully I'm not overloading you, but I'm trying to get through this so you can get back to work and still get some value today. This is all being recorded, so you can jump in on it. This should get over to YouTube. It's still recording, so hi everybody out there. And so what I want you to do, take a look at. So last month the talk was about meditation. Meditation is I don't like that word because it just kind of puts people off and like, oh, I'm no good at meditation. I'm like, that's not the point. It's not about being good. It's about finding a breath in there. But reducing eye strain is going to be really important, and how we do that is if you have a view out your window or not, you can still do it. You can develop your x-ray vision by staring through a wall, and if you don't have a view, if you don't have can't stare at it out at a distance, so one way to do that, to reduce eye strain, is to test your peripheral vision. And so you're welcome to do this with me. And you put your hands right up in front of your eyes, and go ahead and don't follow it with your eyes. Keep looking forward, and then stop right where your fingers leave your range of view. Okay, and just look forward. And so you're kind of triangulating. You're still looking forward, but you're aware of your fingers there, and then continue just to relax your eyes. And in there, just play with your diaphragm a little bit, like move around and just take a nice breath in and let your facial muscles relax. And we've been doing that for like a few seconds, and I hope you feel just a little bit more relaxation in your eyes, and that will help with headaches. That's going to help again with your focus. It's going to help you track words across the screen. And if you're doing that well, it will change your biochemistry. And that is so massively important, and simple breathing changes our chemistry. So just another little trick. Eyes hurt, headache, you feel the tension, let your face relax as you do, and just play with it. And then if you're doing this, this is actually like the first step for a lot of meditative practices, which is basically just brain and mind training. We'll just call it what it is. I don't want to pretend that we're talking about y'all have to go live in a cave or something like that and meditate and shave your head. This is something that's just brain training is what meditation is. It's spirit training, and that just means of like how are you connecting with the world around you and yourself. That's how I define it. Maybe change it. I might change it tomorrow, but that's one way to look at it. And that is one of the first steps is opening up your gaze, looking out, and then you can close your eyes, and then you can go into a breath. And if you do that, that is another couple of layers to drop in with. You know, pick up what I'm saying at your convenience. Don't want to give you too much that you think you have to do it all. And I'm always going to say, go back to the breath. Watch your breath. Structure yourself. That's it. Yeah, I just felt it come across the room a little bit. So there's kind of a universal standard, and we all have different body types. We all have different personality types. we're all individuals. People come. I was at a New Year's Day function, and people came up to me and they're like, "Oh, you're an acupuncturist. Cool. What do you specialize in?" And I was like, "Ooh, that's such a terrible question because it's not like acupuncturists are stuck into the department. They're not like an orthopedic, sports medicine, gastroenterologist. Most people find us for pain, so that's why I'm talking about like carpal tunnel, things like that. But what we specialize in is the individual that's in front of us. So I want to acknowledge everybody to tune into who you are, and then find out how to make it, like just cultivate that garden that you are, and make it bloom. But that's, so like the universal standard of ergonomics, it's not helpful, as we all know. But just, again, different ways that we can optimize. I'll probably cruise through this because I find it kind of boring, but I want y'all to know is that when we're doing ergonomics, your knee, because we have the adjustable chairs, your knee should be right about the level of your chair. Okay, right at your seat level there. So you can start there, and then your thighs should be parallel to the floor. So just stand in front of your chair, make sure it's in the right spot, because then it's going to also be relative to the desk that you're at. But let's start with the chair. And then your armrests just need to be slightly below, so you have a slightly downward angle. You don't want to be up, or you don't want your armrest shoving your shoulders into your ears. Again, we're shutting off all that breathing and circulation. You want that looseness going on, so you have relaxed shoulders. Your keyboard is easy to fix. You can get a lot of keyboard trays if your desk isn't working for you. And again, you don't have to break the bank. You don't have to buy this crazy expensive sit-stand desk, which are nice. You want to be about 2 inches down below, so you're just reaching down just a little bit. And then in doing so, you want your hands in a neutral. We don't want to be doing like a T-Rex thing. So just let your wrists slightly even. You don't want to be up. You don't want to be down. You can get the bumpers to help support you if that's the case. And mousing's also a thing. I don't know if anybody, like, I can't sit on the computer right before seeing patients because I mouse. If I'm mousing a lot, my hands get cold, and people like, one of my favorite people, he always like, "Damn, are you dead? Get your hand off me." So I'm like, okay, I'm sorry, I'll warm up my hand. But if I'm writing a lot right before I start a shift, I have to be really careful of that. But I want to let you know that coldness, if a lot of people that get cold hands, yes, my mom used to say cold hands, warm heart. Yeah, but that's great. But cold hands, bad posture is really what that translates to. But I love the cold hands, warm heart part. But warm up your hands and your heart, and genuinely going back to the vagus nerve, it will change your cardiovascular nervous system, innervating your visceral organs, including your heart. And then a big no-no: don't cross your legs. I love it. If you do, use it sparingly, because you are shutting off all kinds of circulation through your legs, and a lot of return flow. So you're leaving unoxygenated venous return, unoxygenated blood that's slowing down its return to your heart and lungs. Same thing with the garden, going back to the garden analogy. You don't want a kink in the hose. You want to keep that circulation going. Keep your feet, in other words, you're going to keep your feet nice and square. And your computer monitor. You want to be looking slightly down. You don't want to be up because that causes over accentuates this curve of our neck, which should have just a slight curve. But you want to have a slight downward gaze into it, slightly. And then your distance should be right around arm's length for your screen. So make sure you're pulling it forward or scooting forward to your screen just to make sure that you're at a good distance. Another add-on, I would say, get blue blocker glasses. I really love those things. I started to need reading glasses until I just started wearing blue blocker glasses, and it reduced blue light. Made a huge difference in my ability to continue seeing fine print. Because I'm right at that age where it's like I was having to switch glasses. But that's just a little aside. And maintaining your screen. And in that blue light conversation, for those of us that stare at screens, whether it's our phone, an iPad, a Kindle, a computer, watch out for that blue light because that stimulates our pituitary gland, which then tells us stay awake. Because what do in the morning? We're like rejoice in the morning and see that light, and that's the best cup of coffee. I love coffee. I'm not going to tell you to drop it, but you want to make sure that you're getting stimulated properly. And then at the evening, so you can use a couple, iPhone has night shift. If you haven't discovered that in your settings, Flux for Android and computers, make sure you got that going and you can set it to sunrise and sunset so that it will just automatically kick on. I'm gonna quick grab this door. Moving on. There you go. That's the blue light slide. I was just talking to you about that. Copy holder, same thing is with when we're talking about that book. So you're not looking down at papers. You can get a little angle book stand copy holder, so you're not staring down again. And this is just these are the gifts that keep on giving, because this is what we do every single day, and it's really important. Like, there's a huge movement in understanding the importance of enjoying our work, and you guys, I'll say it again, like, you're in service of people, so you should rejoice in that, and I just would hope that you can receive that as much as you give. So a couple stretches that we can jump into some of the exercises are going to be like just shoulder rotations. Bring them up, let them down. Bring them up, let them down, and the other direction is going to be really important because sometimes we can curl in, which is the typical part of this world, is we just collapse in, and again reducing our breath. And then you can do that Wonder Woman breath and just open up in like that posture of holding that open, that man spread, if you will, from like, anybody watch Mad Men, that show with, that guy, you always see, what's his face, the main guy, I can't remember his name, he's always spread out. But if you just look at people, it might not be because they're a-holes. It might be because they understand the physiology and they're not compromising. So be kind to your neighbor. I don't want you to be like that guy in that bus I was telling you about. You don't have to be that guy, but just take your space up a little bit and afford everybody theirs, but own it. But another thing is, so we got the rotations, the openings. Another one that can be really good is just simple shaking. This is a qigong exercise. You just stand up and shake a little bit, and it really just kind of like settles out the garbage, clears your mind, breathing as you do. But how we manage our shoulders, because this is the central passageway for all of this innervation that comes out from about here up. And then it also, going back to the vagus nerve. And keep them stretched out. They come with some of the easy ones. Just give that opportunity to open up that flow. And then honestly, like just showing the simplicity of raising your arms up, going back to that one. It's so important. Just don't be afraid to just stretch it out and let your lungs fill with air. And there's just so much, and that's how you expand these ribs. and because there's muscles in between every rib, and they can misbehave. They're in there in each breath cycle, contracting and lengthening. So this is a good way to just remind them, they give you some space to breathe. Little things, and this is also super applied if you're traveling. You're sitting in a car too long, you're on an airplane, whatever. Use these things. And then you open up your back by stretching forward, but you want to stretch the back. You do the front, you do the back, and you want to stretch those areas out. Hamstrings, we can overemphasize them, but let's make sure that you can just do those lunges and things and just get into that. And again, when we're opening up our hips, we're opening up the lower aspects of our diaphragm, and we're opening up the areas where our vagus nerve terminates. And that can help things like digestion too. So if for bowels that move too fast or too little, like talking about pooping now, one of my favorite topics. I always get in trouble at home for it. But as a medical provider, you gotta take out the trash. And how you take out the trash makes a difference. You don't want to take out the trash too often, and you certainly don't want to take it out too little. Actually, our breath is a huge contributor to that, because our vagus nerve and stress will have a circulatory give and take for information to make sure that those muscles are moving nicely. Let's get going, because I know you all gotta get going. So stretches for your hands and wrists. I don't know what you guys got going on, but easy opens, easy outs. Got you. Take care. Appreciate you. And then, does anybody have carpal tunnel? Does anybody should I just skip the carpal tunnel stuff?
I don't really know what it is.
Oh, carpal tunnel syndrome. So this is the carpal tunnel, like right here at the heel of your hand, and this is where the median nerve comes through. And typically, it's a big tendon that goes through here, and the nerve passes underneath. And when there's reduced circulation, cardiovascular and nervous circulation, that tendon tends to atrophy and contract too much, and it pinches off that nerve. But what I always find, somebody comes in, they have carpal tunnel syndrome, I just go up, put my hands on their shoulders and go, does that hurt? Right here? And I can bring them to their knees usually. I try to be gentle, but the carpal tunnel right here is, like I said, my uncle was an orthopedic surgeon, and what the procedure is just go through and cut it, and just open it up, which tunnel syndrome is.
Pain is in the hand.
Yeah, and so people get numbness and tingling, but usually it's also a lot of people get elbow pain, shoulder pain, neck pain associated with it, and usually it starts upstream. It's like people, we all have tight shoulders and necks and shoulders, and so that is part of it. But yeah, so that's what carpal. Did I answer your question? What carpal tunnel is? Yeah, and it's a really common health problem. What's up?
And I knew someone that has had it for about 30 years. She has it so bad she can't even brush her teeth anymore.
That's it.
Mm-hmm.
That's what I'm talking about. I mean, I'm sorry that's 30 years.
Because she's always been on the computer since the 1980s, so.
It was just some of the little things, and you don't want that to go so far. I work with people that their hands are already atrophied because they've lost so much circulation that the muscles are shrinking. Because the nerves are carrying information to build muscle, and the blood and the oxygen isn't coming, so the raw materials aren't coming either, the nutrients. So if she's a loved one or somebody that you have access to, simple things like, just giving her a shoulder massage, because there's probably a lot of this. Because this conversation surprisingly doesn't happen very often. And then, honestly, I never hear people talk about the breath part, and that's the beginning and the end of it.
Do you think that can end up developing sleep apnea? She has sleep apnea now too.
There's a couple layers. That's a little extra conversation.
Yeah.
The sleep apnea is also going to be probably like a systemic inflammation, where the soft palate of the the hard palate here, and then the soft palate collapses, causing apneas, and that's a soft tissue that tends to respond poorly to inflammation.
Okay.
But it also working on circulation out of the nervous system coming out of the cervical vertebrae will also have a contributing factor. But you can have chronic sinusitis, inflammation, and food allergies and then also musculoskeletal contributions. So it's kind of, my answer is like, yes, and that's why I was saying, like, what do you specialize in, John? I'm like, the individual in front of me. That's what I do, is I work with who's coming to me, and I'm like, okay, what's your version? What's your story? Because after 30 years, I'm probably gonna get multiple chapters, so to speak, out of that story. And then I'm gonna have a couple different approaches to help with inflammation, neck pain, shoulder pain, and then see if we can get the apneas and the carpal tunnel taken care of. Does that make sense?
Yes,
Yeah.
absolutely.
Yeah, so it's like the yes and scenario. You can't divide out the body and say go to that department and that department. And like you just can't pull off this arm and say that
And
this is
just
the
like
left.
what you were saying about your uncle as well, like specialized, in hands and stuff, but you're telling him it has a lot to do with, the certain nerve that,
Yeah.
runs through us as well. So it's just all different type of contributing factors.
It is, and that's the beauty of us
Yeah.
as like the biology of our bodies, and that makes us glorious. And then we just really need to rethink of how we're approaching it, and that's one of the reasons I chose this Chinese medical route, is because there isn't we don't compartmentalize each parts of our body. It's like, well, yeah, we know if there's an emergency, you go to the ER or the specialist, and there's a time and a place. I'm never against it, but I love the organizational system that we have that allows me to like explore that, your friend with carpal tunnel, sleep apnea, and then just, that's a puzzle. It's like, oh, how are these connected? Because they are.
Yeah.
It's impossible for them not to be. So that's one of my big messages. I mean, but you can also help her do these stretches. And let's see here, what else we got? Where are we at? Let's not do any balancing tests today. I mean, you can just see you can test where you're at, close your eyes and stand on a foot, and then close your eyes and stand on a foot. And just make sure that you have something nearby if you need it. But,
This is pretty good, huh?
yeah, that's way good.
Okay.
Okay, so, and then you can hit yourself with the timer and do that, but these are some of the exercises that we're kind of running out on time for. But everybody's like, touch your toes. But if we can touch our toes and put our hands to the floor, well, then maybe it's not so much our hamstrings, so you want to make sure that there's balance to the front and the back. And that's why all these exercises in here are doing that, but I'm also like, open up the hip, because that's a lot.
The lunges are really good.
The lunge, yeah. So just little things, and keep it moving and enjoying that. And then, just keeping loose. Whatever path you take, use your body. Enjoy it. Like stand up, shake it out. Any little pieces, and I'll come into a conclusion here because I know that this is, y'all have to get back to work, but just enjoy it. Try out Pilates, try out yoga. And we can go through this in future talks, because I want to remind you all, I should have said it before everybody started breaking back to work. I'm here every month and then doing these talks. So bring questions. If you're like, hey, last month you said, I usually show up a little early. So you can jump in, send me an email. I'm easy to find. I'm at the Wellbridge Clinic. And then Atlanta and Tori have my contact. I have my cards here. But we're also, sign up for our acupuncture days. We're here twice a month doing acupuncture too. So we're here doing this wellness program for y'all 3 times a month. Next Tuesday, Bradley is going to be doing community acupuncture. So you have the massage team also have acupuncture. It'd be great if you haven't tried acupuncture. We've tried acupuncture, but
will we be doing anything today or?
not today. No,
Okay, so it's next week.
the first Thursday of the month is the
Okay.
talk, and then Tuesdays and the last Thursday of the month, the second Tuesday and the last Thursday of the month are acupuncture.
Okay.
And so I'll be here the first and the last of the two, and Bradley, who's amazing, will be here on the Tuesday. So if it works with your schedule, that sign up is online. Let me know if you have any questions about that, or route that through Atalanta, and she can help you make sure that you can jump in on a schedule.
Yeah, I'm gonna reach out to her because I think I was trying to sign it, but it wouldn't let me. Like it was.
Just show up.
Okay.
I'll make it work. Bradley will make it work.
Okay.
Don't let that be an obstacle.
What's your name?
I'm John.
Okay, it's nice to meet you,
Nice.
John.
What's your name?
Shanice.
Shanice, nice to meet you. And spread the word. if I only did that because it helps us keep a rhythm, but I'm discovering that it doesn't make a difference,
Okay.
just come down. Just come down, and we have 5 chairs so we can overflow a little bit, and everybody gets about 20 minutes, and we try to keep it moving.
Okay.
And then like at the clinic, people come in, you got a 90-minute intake, and then the follow-ups are 60 minutes. So it's a different experience. This is just really quick intake, and then we just make sure that you get like kind of emphasize a highlight of your health, and then do relaxation. And then on those days, I'll tell you about how acupuncture works in the circulation and works kind of like computer programming. Like PT, massage is more like carpentry. We're like the electricians or the computer programmers of the body. And then we'll dive into some of what that means. But just spread the word. If when in doubt,
Oh, absolutely.
show on up. And
Okay.
then we'll do our best to make sure that it works out.
Thank you, John.
Yeah, I'm happy to do it. Like I get all pumped up. I think we got it. I mean, like we'll just go through a couple things and then I do a summary here. But I don't want to keep you from your day. Janice, it's so nice to chat with you and everybody else. I forgot your name.
Christina.
Christina?
Right?
Yeah.
I'm gonna go ahead and email you. I have a couple of questions.
Yeah,
Yeah, and I may have a couple questions. as
please
well.
do. Here, let me give you my card.
Okay.
Yeah.
thank
So
you.
this is my email.
Okay. And it's nice to meet
Oh,
you.
me too. I appreciate you. And it was fun to diving in because when I'm up there
Yeah.
talking, I'm like, I don't want to talk.
Yeah, because I didn't know if I could talk or not. I'm like, I'm just gonna go ahead.
Yeah, please do. Because I told Mary, I was like, I like to interact with people.
Yeah, me
So-
too. Thank you so much.
Yeah, my pleasure, truly. So, yeah, that's amazing. If you have any questions, you can go ahead and direct.
I have it.
Okay.
Yeah, of course. Yeah. One question is, just super quick.
Yeah.
All of a sudden. Someone just told me that anti-inflammatories are not conducive to healing. Is that true?
Oh, okay. So anti-inflammatories, and if they're
Turmeric.
if they're helping
I
healing,
need turmeric.
one of the things is like if you're talking about like ibuprofen, Tylenol, things like that.
No, turmeric.
Oh, turmeric. Oh, turmeric tends to create more of a physiologic change. So let me step back and go. A lot of like over-the-counter anti-inflammatories that we typically use. I grew up on ibuprofen, for instance.
I love ibuprofen.
I know, but
Drug of choice.
I know, seriously, I know, and it was mine to a detriment. But that's like magical thinking. It's weird for me as an acupuncturist because fortunately, there's science to back up what I'm about to say. Is a lot of what like Tylenol, like opiate painkillers, gabapentin, are.
I've never taken any of that stuff.
I would avoid it if at all possible,
Mhm.
but you use your tools when you need them.
Yeah.
So I'm not against that. But it's magical thinking because you're not creating a physiologic change. But when you ask about turmeric, there's a couple layers in there I want to address and how it works for an anti-inflammatory. One, it's nutritional, so you're actually creating a change. It has some antibiotic properties, so if there is a dysbiosis, it will help that. So you're getting layers of benefit. And lastly, it changes circulation patterns. So do some of the other anti-inflammatories, rather than just hitting a mute button for 12 hours or 6 hours. You're actually creating a circulatory change. And in doing so, like you're creating physiologic change, so you're actually doing a training regimen chemically, as opposed to just taking the remote control and just hitting the mute button until, and not changing the channel. So, and then I'm going to say one more thing about turmeric, because one of the big problems with turmeric is that it's so popular. Be careful with the type of turmeric that you get.
Mm-hmm.
You know what I'm saying? So what the deal is it's because the active constituents in turmeric.
I take sea moss.
Ooh, that one's not on top of my tip of my tongue. I don't know sea moss.
Yeah, it has over 180 minerals. It's natural.
Oh, the minerals are good.
Uh-huh.
But so what I would say about turmeric, I want to dive. I'm curious about that, but that's important. But it's a different mechanism. It's a different way it interacts. Is make sure you have fat soluble turmeric. It is in an oil emulsion, preferably. Sometimes they have hyper extracts that are more absorbable.
I use culinary.
Mm.
Okay.
Organic culinary tested.
Oh, fabulous. And when you do that, make sure that you're taking it with lots of oil stirred up. And so if you do a lot of...
That and black pepper.
Great. And black pepper, just as an aside, Ayurvedically in South Asian medicine, black pepper is used used for ascetics who are monks to reduce sexual drive. Just as a heads up. Just whether you want that or not, I don't know. I just want to let you know. It is interesting one, yeah. But going back to the traditional uses, because you go back, I mean, like so much of our wisdom's buried in our language and our history. So like, but one of the things that you always find if you are in a South Asian kitchen that is like Ayurvedic kitchen where they're using these herbs is they'll flour the herbs and just putting it in a lot of oil, and then then the ingredients go in once you've like have your mustard seeds and your cumin seeds, and you get them to blossom in the oil, and that oil
And like the star anise and things like that.
Yes, exactly. All that yummy stuff. And so, but I would just the short version is it can be really helpful. It creates physiologic change. It does have anti-inflammatory properties, but use it properly and make sure that it's an oil.
And
What's up?
I want to mention something about inflammation as well. I used to
You bet.
have a lot of inflammation, from the age of 17 to about 19. But once I gave up pork, I've never dealt with it ever again.
That's a thing. People have different allergies. Yeah.
It used to just make me, I would eat pork the next day, I'm all swollen, couldn't fit my rings, I'm itching, and it was terrible. And ever since I gave up pork, and it's been over 10 years, I've never had any inflammation in my ankles, my knees, like any joint problems ever again.
That is so important that you notice that. And I just want to just validate you in any way I can from here. Is just like listen to your body, and you tell me a story of how you listen to your body.
Yeah.
And like and tinker around with it. If you see something that you don't like in your symptoms, that's your body speaks in symptoms.
Yeah.
Your body doesn't speak English or any other language. Your body speaks in symptoms, and you listened.
Yeah.
And you figured it out. You started
And
tinkering
then
it
too, it's
out.
important too for us to know our blood types, to sometimes eat accordingly to our blood types as well.
And that's how you figure out the clues to the
Yeah.
riddle all the time is like blood type work. And there's so many different approaches to help solve the puzzles.
Right.
But whatever stimulated you intuitively to remove pork from your diet and get the health benefits of taking it out, I mean, tip of the hat to you. That's it. That's it.
Yeah.
That's the best game I can give to anybody when I'm working with them, and I just want to reinforce
and learning
that.
about their like dietary and nutrition and things like that.
Learn about ourselves. Know thyself.
Yeah.
So yeah, good. That's sea moss. That sounds interesting. Yeah, minerals are great.
Yeah.
So
They are. I take ashwagandha, all type of things.
Yeah.
Just natural supplements and stuff that really help.
I like ashwagandha too. We can go into that. Don't believe me. I'm like, oh, okay, we'll be here till like 3. But all right, everybody, thank you so much.
Yes. And it was my pleasure meeting you.
Hey, Shanice, thank you. Appreciate you.
Yes.
Come see me again, and Brad will be here next week, and then we'll talk some more.
Okay, thank you so much, John.
Drop me an email too.
Okay, I will. Take care.
All right. Thanks, everybody. I'm trying to figure out how to turn this off now.